Eagle County is situated in the mountains about 2 hours west of Denver, and the majority of the population lives along communities spread across about 70 miles of I-70 highway that spreads from Vail to Docero. When people think of Eagle County, they probably most often imagine backcountry hiking or camping. Eagle County Healthy Communities Coalition. These relationships span across multiple sectors to create a greater community buy-in for projects that support healthy communities. The Healthy Communities Coalition has been around for about 5 years prior to this project and worked on a variety of projects dedicated to increasing healthy eating and active living opportunities for everyone who lives in Eagle County. The intent of the Healthy Communities Coalition's intent of the Plan4Health project is to develop cross-jurisdictional relationships and common understanding of healthy eating and active living in context of the built environment specifically, to influence future master plans with healthy eating and active living priorities, and to foster more inclusive, authentic community engagement in municipal planning processes. This is a list of partners within the coalition and assisting on the Plan4Health grant. As you can see, we have help from each of the towns within the Eagle River Valley, as well as many nonprofits, community-based organizations, and some private businesses. Eagle County, through the Healthy Communities Coalition and the Plan4Health grant, is addressing healthy eating and active living in the context of the built environment through 3 strategies. The first strategy is through reviewing the comprehensive plans of 6 towns and Eagle County. The towns are Gypsum, Eagle, Avon, Minturn, Redcliffe, and Vail. And we are reviewing the comprehensive plans for elements within the plans that support or detract from healthy eating and active living. This will give us all a common understanding of how municipalities have prioritized healthy living and where there are opportunities to improve in the future. Staff is working together with municipalities to outline their community-specific priorities related to healthy eating and active living in the built environment, and will provide strategy ideas for any future policy development or comprehensive plan updates. We are providing support to municipalities with community outreach by conducting semi-structured interviews with staff and providing resources as well as trainings about community outreach tools and opportunities. This Plan4Health project will result in a clear understanding of how each of the towns is prioritizing healthy eating and active living. It can help position the communities to be competitive for grants, because lots of funders are looking to support health through the built environment, community collaborations, and involvement with community members. The Healthy Communities Coalition has a vested interest in supporting the health of communities. Therefore, this project has instigated relationships with the towns to support healthy eating and active living related projects, which is a benefit that will outlast the term of this grant project. Staff is presented to each town council and receives signed intergovernmental agreements from the elected officials supporting the Plan4Health grant work. The policy scans for each municipality have been completed, and the Eagle County Communications Department is creating a brochure-type document to share with each municipality. The contractor hired to help the Eagle River Valley with developing community engagement strategies has interviewed community members and is currently developing a final report on the findings. We already held a full-day community engagement and health equity training on June 20th, 2016, which included partnerships from around the state, or participants, from throughout the state. We are following this training up with meeting on a regular basis with the participants from the Eagle County area and continuing to develop relationships which will last even after the Plan4Health grant is over.
Our hope is that these activities and the policy scan reports will lead the towns to adopting resolutions supporting healthy eating and active living. The final strategy involving community engagement with the interviews has been completed, and our meeting has been set up in January of 2016 to discuss the findings and recommendations discovered during the process. With relationships and creating a shared vision, there is a greater possibility of healthy eating and active living principles being incorporated into future land use policies and regulations. As a planner, through this grant, I've discovered that healthy community design creates choices, healthy choices for our community. If our community doesn't plan to be healthy and active, we take that choice away.